Welcome, everyone. Today, Benzo Warrior Community is excited to welcome Dr. Valsa Madhava to our speaker series on all things benzodiazepines, withdrawal, and recovery. Dr. Valsa Madhava, MD, MPH, MS, IFMP, is a board-certified internist and addiction medicine physician specializing in complex benzodiazepine withdrawal and neuroimmune stabilization. Her work integrates mechanistic stress neurobiology, functional and systems medicine, clinical neurophysiology, patient-centered recovery. Her 2025 study introduced the 5-axis framework, the first biologically grounded model of benzodiazepine withdrawal phenotypes, mapping CRH adrenergic activation, excitatory neuroinflammatory responses, autonomic instability, cerebellar basal ganglia motor gating changes, and MCAS overlap patterns. Her mission is simple: make recovery safer by stabilizing the nervous system. After Dr. Madhava presents her recent study, we'll go to a Q&A period so Dr. Madhava can answer whatever questions you might have about the research. Please put your questions in the chat. We're a large group today, and we'll be vetting and grouping those questions and asking them for you. While we're at it, I'd like to encourage you to check out the rest of the BWC speaker series if you've missed any. The talks are on the Benzo Warrior YouTube channel, or you can find them in Guide 62 of the BWC guides as well. Dr. Madhava, welcome to BWC, and thank you so much for coming today.
Thanks, Barbara, for having me. And I will get started. Hi, everyone. Thank you so much for being here. I know that for many of you, just showing up to a talk like this can take a lot of energy and courage, especially if your nervous system has already been through a lot. Some of you may remember that I spoke to this community a couple of years ago. Since then, my thinking has changed and deepened, not because the earlier ideas were wrong, but because I kept running into patient experiences that I couldn't fully explain. I've tried to understand withdrawal from many different angles, but it wasn't until I started thinking in terms of stress biology, how the nervous system actually organizes threat and safety, that the missing pieces finally came together. This framework helped me make sense of symptoms I couldn't explain before. This talk is not about fixing you. It's about helping you understand what is happening in benzo withdrawal. And when we understand, things usually feel a little less scary. This talk is really about a few simple things. First, what benzodiazepines actually do to the nervous system. Then, why withdrawal can feel so intense and confusing, and why that doesn't mean you're broken. We'll talk about why symptoms tend to come in patterns, and I'll show you a simple way to organize those patterns using the 5-axis map. Not to label you, but to make things less scary. Then we'll talk about why stabilization needs to come before tapering, and why this can lead to a kinder and safer tapering. Of course, all of these topics are very important. And before we dive in, I want to say something important about how to listen to this, because this talk is meant to support your nervous system, not stress it. You don't need to understand everything. You don't need to remember everything. If at any time you need to pause, rest, or step away, that is completely okay. Take what helps and leave what doesn't. There is no right way to listen. You don't have to track every detail. This is about understanding and not forcing anything. I want to be very clear about what this talk is not. This is not medical advice. I'm not going to give you a taper plan. There will be no promises about how long healing takes. It's also not a test of what you should or shouldn't be doing. There's nothing in this talk that you need to get right. This talk is about understanding, not urgency, not pressure, and definitely not performance. If anything you hear today feels helpful, you can keep it. If it doesn't, you can leave it. This information is meant to support your nervous system, not stress it. So now that we've set those boundaries, let's talk about what's actually happening inside the stress system. Your nervous system is not broken. It's doing exactly what it evolved to do, keep you safe. What scientists often call the stress response system is really your survival system. Its job has always been to protect you. This isn't a metaphor. It's really a set of biological systems that work together. And this is where we start, because this system explains most of what people experience during withdrawal, in the body and in the mind. It's a set of brain and body circuits designed to protect you from danger, injury, and death. When this system becomes destabilized, its signals can become loud, frequent, or too intense. But its purpose never changes. It's always aiming for your safety. So we're going to begin with basics, what this system is meant to do and how it normally works. Before talking about what is wrong, I want to show you what the system is supposed to do when it's functioning well. Because when you understand that, you can start to see your symptoms for what they really are. Not a personal failure, not a mysterious disease, but a misfiring of a normal safety mechanism. So let's start simple. What is this system actually designed to do? The foundational job of your nervous system is survival. That means it is constantly scanning your environment and your body for anything that might signal danger or threat. And to do that well, it needs balance. It needs systems that can turn things on when there's danger and systems that can turn things down when you're safe. One of the most important stabilizing systems in the brain is the neurotransmitter called GABA. I'll explain what GABA does in a moment, but the key idea is this. Your nervous system is built to protect you. When it gets destabilized, the protection signals can get too loud. So let's talk about GABA for a moment because it's central to everything else I'm going to explain. GABA is a neurotransmitter, a chemical messenger in the brain, and it's often described as the brain's calming chemical, the inhibitory neurotransmitter. But that description is too narrow. GABA doesn't just calm emotions or help you sleep. It acts more like a brake on your entire survival system. When something feels dangerous, your nervous system is designed to react quickly. Heart rate goes up, muscles tense, ready to respond to threat. That's the accelerator, the part of your system that mobilizes you for danger. Once safety returns, something has to slow that system back down. That's where GABA comes in. GABA helps your system slow down again when you're safe. So GABA helps slow the reactions, reduce overfiring, and bring things back toward baseline. So instead of thinking of GABA as a relaxation chemical, it's more helpful to think of it as a brake, something that helps your body settle once the danger has passed. So now I want to make this more concrete. When I say a stress system or survival system, I don't mean a vague emotional thing. I mean a very real biological network that controls a lot of what you experience as physical symptoms. The stress system controls many areas: how alert you feel, how easily fear turns on, your sleep-wake rhythm, your heart rate, breathing, digestion, temperature, movement, and even parts of your immune and inflammation responses. This is why withdrawal doesn't just feel like anxiety. It can feel like your whole body is involved. When this stress system becomes unstable, symptoms don't stay neatly in one category. So if you've ever wondered, why does withdrawal hurt my heart, my gut, my sleep, my temperature, my movement? This is why. It's not random. It's not multiple unrelated problems. It's one system with many branches. And GABA helps the system, the survival system, the stress response system from overreacting. It's that important. So where do benzodiazepines fit into all of this? Benzodiazepines work by strengthening the effect of GABA. In other words, they act like an extra outside brake on the nervous system. At first, that can feel like relief, less anxiety, less tension, less reactivity, more sleep. But the brain is an adapting organ. It's always trying to keep balance. So when an outside brake is present for a long time, the brain slowly adjusts. It weakens its own internal braking system because it assumes the medication is doing that. This is not damage, it's adaptation. When the medication now is reduced or removed, the system is suddenly left with a weaker internal brake. And that's when the stress system can become louder, more sensitive, and more reactive than before. That's what people experience as withdrawal when you don't have enough of the GABA effect. This is where a lot of that fear comes from. When the braking system is weaker, the alarm system turns on too easily. Things that once felt neutral can start to feel dangerous. Normal body sensations can suddenly feel threatening. And often, the body reacts before the thinking part of the brain has time to interpret what's happening. That's why people say, I know I'm safe, I'm logically feeling safe, but my body doesn't feel safe. That's not a contradiction. That's biology. The survival brain reacts first. The thinking brain catches up later. This is not a character problem. It's a temporary, dysregulated survival system. One of the most confusing things about withdrawal is about how physical it feels. People often say, my body feels wrong. My heart is racing. My stomach is in knots. I feel shaky, unreal. And when no one explains what this is about, people start to worry. Is this dangerous? Is this permanent? Am I losing my mind? But here's what's actually happening. Your stress system controls the body, not just the thoughts. It's like a fire alarm. It's designed to be fast, loud, and automatic. It doesn't wait for permission. It doesn't check to see if the threat is real or not. It just goes off. That's why your body can feel wrong before your mind does. That's why you don't have to believe you're in danger for your body to react. These are body level reactions, not imagination. So here's something really important. Most people assume their symptoms are random, that they're all over the place, that nothing makes sense, but they're not random. They follow the wiring of your survival system, the stress circuits. Different parts of that system control different functions. Heart, sleep, movement, sensory processing, threat detection, they're all parts of the same circuit, the same stress circuit. So when certain circuits or these pathways are louder or more sensitive, you get certain types of symptoms. That's why people tend to have symptoms in clusters, which we'll talk about shortly. That doesn't mean one person is sicker than another. It just means different parts of the same system are loud for different people. And once you see that, things start to feel less chaotic. So if symptoms are not random, the next question becomes, how do we make sense of those patterns? This is where the idea of a map comes in. A map is not a diagnosis. It's not a label. It's not something that defines you. A map is just a way of organizing something complex so it feels more understandable. Think about how different it feels to walk through a strange city without a map versus with one. The city hasn't changed, but your experience of it has. You feel less lost, you feel less afraid, and more oriented. In the same way, having a way to organize your symptoms doesn't mean anything is wrong with you. It just helps you understand what your nervous system is doing. And when you understand what's happening, it becomes less overwhelming and less frightening. So this is the organizing map I use. I group symptoms into 5 main stress systems, not as diagnoses, but as a way to notice which systems are loudest. When I looked across many people's experiences, their symptoms, what stood out was that even though the details were different, the types of symptoms often grouped together, not randomly, but in patterns. I grouped these patterns into 5 domains, 5 real stress systems in the brain and body, which I call axes. Each one represents a real biological system that can become louder during withdrawal. Louder because you're unstable. The whole system becomes unstable. And most people don't have just one loud system. They usually have a mix, and that mix can change over time. So this is not about categorizing people. They're not diagnoses, they're not labels, they're not boxes. It's about helping you recognize your own symptom patterns. Here's the same idea just shown visually. These are the same 5 axes from the last slide, just organized into a pentagon. The point is that they aren't separate. It's that they interact. They're all part of one survival system. They influence each other. That's why symptoms often overlap. You might have panic and gut symptoms or sensory overload and movement symptoms. This doesn't mean you have multiple unrelated problems. It means multiple parts of the same survival system are active at the same time. And this is also why symptoms can shift. One week, one axis might be louder, another week, another month, some other circuit might be louder. This doesn't mean you're getting worse. It means that this is a dynamic, movable system, moving system. So far, I've shown you the structure of the map. Now I want to translate that into everyday language. This is just a quick preview. We'll go through each of these slowly shortly. Each axis is a different brain-body system that can become dysregulated. Axis 1 is the alarm system. This shows up as increased stress hormone, adrenaline surges, and it's the fear circuit. Axis 2 is brain on fire. This shows up as overstimulation and inflammatory overload. Axis 3 is the body regulation axis. This affects heart rate, blood pressure, digestion, and temperature regulation. Axis 4 is the movement axis. This affects balance, stiffness, tremor, and motion sensitivities. Axis 5 is the reactivity axis. This shows up as histamine-like reactions or food or medication or supplement sensitivities. Most people have 2 or 3, occasionally they'll have 1 of these axes active at one time. And that mix is what shapes how withdrawal feels for you. I'm going to walk through these 5 axes one at a time, slowly and in plain language. This is just to explain what they are and not to analyze yourself. We'll get to personal patterns later if that's helpful. Axis 1 is the alarm axis. It's your brain's danger detection system. When it works well, it turns on for real threats and then turns back down. When it's dysregulated, it turns on too easily and stays on too long. That's when people feel sudden fear, adrenaline surges, internal shaking, waking up with dread, or constantly on edge. Many people say my body feels stuck in an on mode. And that's exactly what's happening. A loud alarm does not mean real danger. It means the alarm is misfiring, like a smoke detector going off with no fire. Axis 2 is about excitatory overload. This system controls how sensitive your brain and nervous system are to input, like light, sound, touch, thoughts, and emotions. When it's balanced, you can take in information without feeling overwhelmed. When it's dysregulated, everything feels like it's too much. People often describe feeling wired, overstimulated, jumpy, sensitive to noise or light, unable to rest, like their brain won't settle. It's not anxiety in the emotional sense, it's a nervous system that has its volume turned up high. This doesn't mean you're fragile. It means your system is temporarily set to high gain. Axis 3 is about body regulation. This system controls things like heart rate, breathing, digestion, temperature, and blood pressure. You don't consciously run this, it's automatic. When it's working well, you don't notice it. When it's dysregulated, you definitely notice it. People feel things like dizziness, nausea, gut issues, racing heart, temperature swings, breath hunger, or sudden fatigue. This is why symptoms can feel so physical. This isn't in your head, this is body level regulation. And just like the other two axes we talked about, it can recalibrate over time. Axis 4 is about movement readiness. This controls muscle tone, restlessness, stillness, and the feeling of being able to settle or not. When it's balanced, you can move when you want, rest when you want, and feel physically grounded. When it's dysregulated, people can feel restless, tense, unable to sit still, internally jittery, or sometimes the opposite, heavy, slowed, or frozen. Some people feel an intense urge to move. Others feel stuck or shut down. Both come from the same system being out of balance. This is not psychological weakness, it's motor regulation. And the last axis is axis 5. It involves your immune and inflammatory signaling systems. This system is meant to protect you from real threats like infections or injury. But when it's dysregulated, it can stay activated even when there's no danger. People often experience body pain, flu-like symptoms, pressure, burning, chemical sensitivities, food reactions, and a general sense of being unwell. This can feel very scary because it's vague and hard to explain. But again, this doesn't mean damage. It means the body's protection systems are turned up too high. As I said before, most people don't have just one dominant axis. The real patterns are usually mixed. You don't belong to one category. Your pattern can look different from someone else's. The goal here isn't to label you, it's to give you language to what you already feel. These are patterns and not boxes. Another reason things can feel so confusing is that the loudest system can change over time. Stress, illness, sleeplessness, or medication changes can all shift which system is most activated. That's why it feels like the main problem is 1 month, and then another month it can feel completely different. This is also why we don't try to fix everything at once. We focus on calming the loudest systems first so the whole body can start to settle. Before I go any further, I want to be very clear about this next part. So you don't need to analyze yourself. You don't need to figure anything out. This is optional. It's gentle, no pressure. I'm just showing you how some clinicians may think about patterns, not asking you to do this right now. We have briefly heard what each of these 5 axes and the systems feel like. I want to zoom back out. This image shows how they sit together, not as separate boxes, but as interacting systems. This is why symptoms often feel mixed. This is why they don't arrive all at one time. Most people have just one system or 2 systems active. Usually 2 or 3 are louder at the same time, and those combinations can change. So when someone says, I feel panicky, dizzy, overstimulated, and shaky all at once, this framework says that makes sense because it can involve any of these branches of the same survival stress response system. That's not chaos, that's multiple systems talking at the same time. And mapping helps us notice that without blaming, labeling, or forcing answers. If the framework we're discussing feels useful, here's the gentle way to use it. You don't need precision. You don't need to label everything. Since most people have just 1, 2, or 3 systems that are loud, Just noticing what feels the loudest for you is enough. This is not homework. It's not a task. It's not something to push through. If noticing patterns makes you feel calmer or clearer, then it's useful. If it makes you more anxious, then drop it. This framework exists to reduce fear, not add pressure. I want to be very clear about what this map does not mean. It does not mean your symptoms are imaginary. It does not mean you caused this, and it does not mean you need a quick fix or miracle solution. This framework is based on something very real. There are biological changes in the stress circuits that can be supported. Naming patterns doesn't erase suffering, but it sometimes helps people to suffer a little less and make gentler choices. And that leads to the next question. What does support actually look like when one of the systems is loud? This slide is not medical advice and it's not a list of instructions. It shows the general directions. These systems tend to move when they start to calm. Different systems calm in different ways. The common theme among all of them is the same: gentler, simpler, more predictable rhythms. And that tells us something important. Nothing here is permanent. This is biology, and biology can change. So the goal isn't to fix everything at once. The goal is to help the nervous system feel safer first. And how do we do that? I want to pause here because this is one of the most important ideas of this whole talk. In most areas of life, we're taught that pushing through is how you get stronger. If something is hard, you just keep going. But the nervous system doesn't work that way. When your stress systems are loud, unstable, and overwhelmed, adding more stress, like a dose reduction, can actually make things worse, not better. Stabilization isn't a delay. It's not quitting. It's not failure. It's about creating enough safety and steadiness in the nervous system so that a change like tapering becomes possible. That's why in this framework, we calm the nervous system first and then taper. So what does stabilization actually mean in practice? Some people hear stabilization and worry it means getting stuck or giving up. That's not what I mean. Stabilization is an active phase, reducing stress and volatility so the system can re-regulate. We don't chase every symptom. We calm the loudest symptoms first. Healing needs steadier conditions, and that matters because healing doesn't happen well inside chaos. It happens when the system feels a little safer, a little steadier, and less overwhelmed. This is what makes a safe taper possible. So stabilization is often the phase where real healing actually begins. And here's why stabilization matters so much biologically. When your stress system is loud, everything starts triggering everything else, as we discussed before in that map. One symptom sets off another. Sleep affects digestion, digestion affects anxiety, anxiety affects sleep, and so on. It becomes a feedback loop, and there can be many feedback loops. Stabilization interrupts that chain reaction. It gives your nervous system a steadier set point to work from. From that steadier place, things like sleep, digestion, heart rate, and energy can begin to regulate again. Most importantly, stabilization creates a safer platform for taper changes. So stabilization isn't about fixing everything at once. It's about creating enough steadiness that real change becomes possible, which leads to the next question. What does stabilization actually look like? Stabilization looks different for different people. Different systems need different kinds of support. If your main pattern is alarm, your nervous system often needs more predictability, steady routines, clear safety cues, and consistent timing. If it's brain on fire, it usually needs less stimulation, more gentleness, and permission to do less. If it's regulation, it often needs physical steadiness, regular meals, fluids, and steady rhythms. If it's movement, it often settles with slow, rhythmic motion. If it's reactivity, it often needs simplicity, fewer inputs, one change at a time. This isn't a checklist, it's a way of thinking. We're not trying to calm everything at once. We stabilize the loudest systems first, because that gives everything else a chance to settle too. And this part really matters. Stabilization is not a pause, it's active, it's intentional, and it's what makes real change possible. Which brings me to the next idea, why stabilization isn't a detour, it's the path forward. This is where we need to slow everything down, because this is not a race. It's not a performance, and it's not mind over matter. When the nervous system is dysregulated, healing doesn't come from pushing harder. It comes from safety, from stability, from predictability, and you need patience and compassion for yourself. That's not motivational, it's biology. A nervous system that feels unsafe cannot rewire. If it feels pressured, it cannot settle. Stabilization isn't giving up, it's what allows healing to happen. And it's what makes tapering possible. So if stabilization is the foundation, the next question is, how do we know what to stabilize? And I want to show you that looking at a real example. Up to now, we've been talking in big picture terms about systems, patterns, and biology. But these aren't abstract ideas. They show up in real people with real symptoms every single day. So I want to make this more concrete. I'm going to walk you through one real pattern and show you how this framework changes the way we think about care. Not by forcing improvement, but by listening to what the nervous system is actually doing. So this is one case story. So this is a very common withdrawal pattern. It's what's called the alarm and regulation mix. This was someone who had been on daily benzodiazepines for a long time and had multiple very difficult dose reductions. Over time, the nervous system became increasingly jumpy and reactive, especially around any changes in dose. What they reported wasn't just anxiety, it was deeply physical, waking up with dread, internal shaking, heart racing, sweating, temperature swings, gut urgency, all of this while feeling completely exhausted. They could still function outwardly, go to work, talk to people, but inside, their system felt like in crisis mode. This is not someone doing it wrong. This is not weakness or lack of willpower. This is what it looks like when specific stress circuits stay loud and stuck in overdrive without an easy switch off. And once we understand that, we can start becoming less afraid of our own bodies. Now I want to show you how this person's experience looks when we map it by axis. Instead of saying everything is wrong, we ask a more precise question. Which stress systems are the loudest now? In this case, the dominant pattern was axis 1, the alarm axis, the part of the system that handles threat and danger signals. That explained the early morning dread, internal shaking, and the constant sense of danger. So we didn't try to talk them out of it. We worked directly with that circuit, using inputs like dim lights, quiet sounds, gentle morning awakening, and slow, predictable movement. The second major pattern was axis 3, the autonomic or regulation axis. That's where you get the racing heart, temperature swings, gut issues, and POTS-like symptoms. So again, instead of chasing every symptom, we supported the underlying system by focusing on fluids and electrolytes, salt, lower leg compression, and pacing their activity. And when we stabilize those two axes, not everything, just those two axes, even though he had other axes involved, symptoms became more tolerable. They're not perfect symptoms. They did not go away, but they became quieter, less volatile, and more livable. The goal is never to erase every symptom. The goal is to stop the system from constantly firing emergency signals. What this case shows is that we're not trying to fix symptoms, we're working with systems, and that changes how we think about everything. When we chase symptoms, we're always behind. A new symptom shows up, we panic, we try something new, we get scared, and then the system crashes again. So a new symptom, a new strategy, new fear, new crash. That cycle feels active, but it's actually very reactive. The problem is that symptoms are not the root, they're signals. They're messages from systems that are overwhelmed, sensitized, and stuck in threat. So we only respond to the signal and not the system creating it. Otherwise, we end up playing whack-a-mole. That's why this model works at the system level. Instead of reacting to every new sensation, we start changing the conditions that produce them. That's why this approach feels calmer, not because it's passive, but because it's doing deeper work. This is not reactive care. It's not patching. It's pattern-based care. We're teaching the nervous system new patterns of safety, not trying to suppress every signal it sends. Here's a mismatch most people never get told about. We're taught if it's not changing fast, you're failing. So we push, we try harder, we look for the one insight that should fix it. But the nervous system doesn't change through insight alone. It changes through patterns, safety, predictability, gentle inputs, repeated over and over again. That wires the threat circuits. Not willpower, not pushing, not fixing. So this isn't motivational. It's biology that takes its own time. Here's where I want to reset expectations about what healing looks like. Most of us expect healing to feel dramatic, breakthroughs, incitement, insight, transformation. So when nothing dramatic is happening, people assume nothing is working. But biologically, stabilization looks quiet. It can feel boring, repetitive, nothing special is happening. That can be unsettling because we're taught the progress should feel like progress. But nervous systems don't heal through drama. They heal through safety signals, through predictability, gentle inputs, and repetition. This phase doesn't look impressive, but it's doing deep work. This slide explains why stabilization can feel like nothing is happening. There's no dramatic relief, no breakthrough moments, no clear win when you suddenly feel better. What usually changes is quieter, fewer emergencies. That's it. Fewer episodes of needing something emergently, like emergencies or going to the urgent care center. That's it. Less crisis, less escalation, less constant alarm. It doesn't feel impressive, but it's real progress. Most people miss real progress. They're looking for symptoms to disappear. But stabilization doesn't mean no symptoms. It means less volatility, fewer spikes, shorter crashes, more recovery between flares, slightly more capacity, more predictability. Instead of living in constant emergency mode, the system starts to settle. This kind of progress is subtle. It's easy to overlook, but it's the foundation for everything that comes next. Progress here is quieter, not louder. When the nervous system is loud, everything triggers everything else. One bad night, then a gut flare may happen. Panic happens, worse sleep, and again, more symptoms. It's a chain reaction, but stabilization interrupts that loop. Not by fixing everything, but making the system less reactive. It reduces volatility, it lowers cross-triggering, it prevents overload. What that creates is a margin, room to recover and room for error. And that's why stabilization makes tapering safer. Not easier, but safer. This slide is here to normalize what people do when they're scared. When symptoms don't go away quickly, the nervous system reads that as danger. So people understandably start making changes, not because they're reckless, because they're trying to feel safe. But this often backfires. Each new change adds load to the nervous system. Each new strategy adds pressure to what the nervous system needs to do. So instead of settling, the system stays on high alert. That's why people can feel like they're doing everything right and still crashing. Not because you're failing, but because stability comes from consistency, not intensity. Instability often returns when we try to escape discomfort too quickly. Not all discomfort is danger, and trying to overrun it or outrun it often keeps the system stuck. This is central to this framework. People often think that if they were stronger, more disciplined, or more motivated, they'd be healing faster. That's not how the nervous systems work. Threat circuits don't downshift because you want them to. They downshift when they experience safety repeatedly over time. That learning is biological and it takes repetition. That's why pushing harder doesn't speed this up. It usually slows it down. This isn't about willpower. It's about how long it takes the brain and body to believe they're safe again. And no amount of forcing changes that. Everything I've said so far was about stabilization, about safety, repetition, predictability, and time. That doesn't stop being true when tapering begins. In fact, it becomes more important because tapering isn't just a medication change. It is actually a stress test on the nervous system. And when that stress leads to collapse or healing, depends on how we pace it. Safe tapering isn't about speed. It's about letting the nervous system, not the calendar, set the pace. Safe tapering isn't about going slowly just to go slowly. It's about responding to what your system can actually handle. If symptoms spike, that's not failure, that's information. Stabilization isn't separate from tapering, it's a part of it. Consistency matters more than speed because biology adapts to patterns, not pressure. So, this isn't about toughness, it's about working with the nervous system, not against it. People often think faster tapering means stronger, that they're stronger, or holding means holding the taper, or holding a dose means that they're failing. That when they experience symptoms, that there's some sort of damage, and they think rest, like if we're sort of holding at a certain dose, that means we're avoiding something. But biologically, none of it is true. Faster often destabilizes. Holding is often protective. Symptoms don't equal harm. Discomfort isn't the same as danger. And rest is how the nervous systems recalibrate. Now that we've corrected what people often get wrong, the slide is about what actually matters. The goal is not to eliminate every symptom, and it's not to push through all costs. The goal is to protect the nervous system while it recalibrates. Because if the system feels unsafe, it can't adapt. Safe tapering means making change tolerable, not heroic, not impressive, just tolerable. And that's what makes healing biologically possible. This is about capacity, nervous system capacity, and not toughness. So you need stability and not speed, and safety for the nervous system by not forcing it. This is the part where I want to zoom out. If you don't remember anything technical from tonight, I hope you remember this part. This framework is not about labeling you, it's not about putting you in a box, and it's not definitely about telling you what to do or what you should be doing. It's about helping you understand what's happening in your body in a way that makes it feel less mysterious, less personal, and less scary. When we see patterns, we usually feel less lost. And when we feel less lost, we often feel a little safer. And safety is where healing begins for the nervous system. If I had to summarize this whole talk, it comes down to a few simple ideas. Long-term benzodiazepine exposure doesn't just affect mood or anxiety, it affects multiple stress regulation systems across the brain and body. This is why symptoms can feel so widespread and confusing. One day it's sleep, then it's gut, then it's panic, then it's sensory overload. It can feel random, but complexity doesn't mean chaos. These symptoms follow patterns. They cluster into recognizable groups, and that's what this framework is really about. Not labeling people, not putting anyone in a box, but organizing symptoms so they're less frightening. Because when you can see a pattern, you're no longer lost. You can say, this isn't my fault, this isn't weakness, this is biology under stress. And when you understand the pattern, you can make safer choices. Not braver ones, not tougher ones, just wiser choices. Choices that work with the nervous system instead of fighting it. While I say this is biological, I don't mean it's permanent. I mean it's real. And real systems do change. The nervous system is dynamic, it adapts. Stress circuits can recalibrate over time. Not instantly, not by force, but gradually. Most people don't go from severe symptoms to fully healed overnight. What usually happens first is tolerability. Sleep improves a little, reactivity softens a little, fear reduces a little, and that matters because tolerability is not nothing. It is the beginning of recovery. Progress doesn't come from forcing. It comes from safety, from predictability, and consistency. These are regulatory systems, not structural damage. That means they can settle. And when they settle, people often regain steadiness, not because they tried harder, but because their biology was finally allowed to. What I want you to leave with tonight is not a checklist. It's a way of understanding what's been happening in your body. What maybe you could be experiencing is consistent with a destabilized stress system. That doesn't mean you're broken. It doesn't mean you're weak, and it doesn't mean you failed. It means your nervous system has been pushed outside its regulatory range. And when that happens, symptoms emerge. Not randomly, not because you're imagining them, not because of a personal flaw, but because there is a mechanism. And when something has a mechanism, it becomes understandable. When something is understandable, it often becomes less frightening. Understanding doesn't necessarily magically erase symptoms, but it changes how you relate to them. And that shift alone can reduce suffering. Because fear itself is one of the strongest drivers of worsening. It keeps the stress system activated. It amplifies sensation. It accelerates spirals. So if this framework helps you be a little less afraid, a little less ashamed, and a bit more steady, then it has already done something meaningful. Less shame, more understanding, more steadiness. That's the goal. Thank you for being here. Thank you for listening to your body, and thank you for staying curious instead of judging yourself. If this talk gave you even a little bit more understanding and less fear, or a little bit more gentleness towards yourself, then it did what it was meant to do. Your nervous system is not broken, it's responding, it's adapting, and with safety, it can learn again. If this framework feels helpful and you want to learn more, you're welcome to explore my website. But I want to be very clear, you do not need more information to heal. Healing does not require becoming an expert. Understanding can sometimes reduce fear, but it is not a requirement for recovery. This framework that we discussed today grew out of years of clinical work, listening closely to patients, noticing patterns, and trying to understand what wasn't being explained by other existing models. I wrote about these patterns in a research paper last year. which is linked here if you're curious, but this is completely optional. You don't need to read anything to heal. Understanding, again, can sometimes reduce fear, but healing does not require you to become an expert. And before we move into questions, I want to say there's absolutely no pressure to ask questions. You can just listen, you can just rest, and that will be good enough.
Thank you so much for that talk. I think what is so great about this research is it takes us beyond all the talk about how to taper, because there's a lot of that, right? The Ashton Manual and Maudsley and the technical details about how to taper. And this talk opens up so much more about what withdrawal is about beyond just sort of the mechanics of tapering. And the other thing that I think is hugely helpful is it gets us beyond these lists of symptoms, right? The BIND research was so important in establishing that there is a problem, but it didn't really tell us all that much about what withdrawal is, other than this long list of scary symptoms. And we're really grateful for your work pushing the knowledge base about what withdrawal is a little bit further. I am going to stop the recording now, and we're going to open the